Welcome to the Whole Health Podcast,
where a functional nutritionist and a biological dentist investigate the interconnectedness of your health.
Let's get started.
Welcome back to the Whole Health Podcast. I am thrilled today to be here with Dr. Erich please pronounce it for me.
Lieberknecht.
Lieberknecht. I've been brutalizing it. My apologies. I appreciate you clarifying that for me. Dr. Erich Lieberknecht is the owner and operator of Beeline Clinic, a hyperbaric and wellness clinic in Bend, Oregon. The clinic offers advanced therapeutics for optimal health, wellness, and recovery. Dr. Lieberknecht has made a lifelong pursuit of helping people heal on a foundational cellular level using advanced clinical tools and health guidance. His undergraduate study of biology and chemistry were foundational in the depth and understanding of the human body that were further enhanced with a doctorate in chiropractic medicine. Dr. Lieberknecht provides personalized, humanistic, and scientific-based care for a wide range of health conditions. Thank you for being with us today, Dr. Lieberknecht.
Oh, you're welcome.
I am so thrilled. We met back in May for the first time. You were so generous and hospitable. You let my wife and I come in late on a Saturday after you'd already seen patients, and you guided us through what it is that you're doing in your clinic. And as I just mentioned in your bio there, thank you for sharing that you trained in chiropractic medicine. And when I think of, going to the chiropractor, it's like, whack, pop.
Sure, bone out of place model, right?
Yes, absolutely. Yeah. And that was completely opposite from my experience at your practice. So I'd love to start by maybe go ahead and share with us your story of how did you come to pursue chiropractic and then the path that led you into this incredible practice you have in Bend, Oregon.
Sure. So the story is, I'll try to make it short and concise. I was born on the East Coast in a military hospital, and the first 3 years of my life, I had pneumonia 14 times.
Wow.
Lived in an oxygen tent on and off, was a pretty unhealthy child up until my teen years, and where I started to get better and better was pivotal with the guidance and care of a chiropractor in Colorado Springs, Colorado, named John Doherty. And he identified some key issues with my digestive health, my gut health. And we worked on that. And within probably about a year, I was no longer taking any sort of medications whatsoever.
Wow.
I mean, I was daily oral medications for asthma. I was overtreated with antibiotics and steroids for most of my early life. And really, no one really identified anything of that, except for the fact that this doc caught the gut biome early on, back when it was called Candida subclinical, and directed me to a better diet and healthier life. And then I basically relived my childhood in my 20s, which was fantastic. So his influence in me at the earlier part of my life was the key for the direction towards chiropractic. Initially, I thought I was going to go down the path of osteopathic medicine, but I really felt like to put aside a prescription pad and focus on vitalistic, fundamental health direction and basis for care was like the point at which I wanted to get to in life, right? So it's harder and it's more interesting, in my opinion.
Mm-hmm.
And it takes more time, and it's an individualized thing. It's not a one 5-minute appointment or 15-minute appointment. It's a lot of work and a lot of progression into people's lives and their care and getting them better. And that's kind of where I got into it. And I started off at the Chiropractic College in Portland in 2005. Great program. You went to school at Western States. It's more the most academic, rigorous schools in the United States for that profession, and it launched me into a different path. I thought I was going to be in the spinal adjustment world for a while, and I just literally don't do any of that anymore. Yeah. I found other ways to address most of the conditions of the body without having to do any bone out of place adjustments.
Yeah.
Anyhow,
Which and I can speak to that. My first exposure to chiropractics was when I had leased a space in my building for a number of years to a chiropractor. I'd never seen one, and I guess my point is, like, when he did some adjustments for me, because I'd had more accidents in my life riding bikes and doing fun things, and I was like, whoa, like this is incredible. Just in and of itself, it certainly has a place, but what intrigued me when I first met you was, like, we come into this space and, I'm seeing like pulsed electromagnetic field systems. I'm seeing light therapy beds. I'm seeing Balancer Pro suits to help lymphatic movement. Mm-hmm. So I'm curious, like, what shifted there that you're like, oh, I'm pursuing this stuff?
I mean, essentially I'm a nerd. Really what it comes down to. I really, really enjoy looking at the body on a very, very simplistic model. How do you get the cells to perform better, right? Mm-hmm. Oxygen is key, right? Obviously, 3.5 minutes of oxygen or without oxygen, we cease to exist, right? So at the very beginning of all of this evolution about a decade ago was hyperbaric oxygen therapy in the clinic. Literally, that was the changing point. I was working with concussions and seeing people not improving at all and not having the right tools to help people. And then I dug around in the research, as we all do, and I found hyperbarics to be one of the best tools you can use to help heal the neurological tissue. Mm. And that's how it all started. And soon after that, the clinic grew and grew and grew. And then I thought, okay, well, I've got to bring in, how do I bring more energy to the cells after introducing oxygen? And how do I detoxify the body? Because that also hinders the oxygen transport system, right? So lymphatic drainage, PEMF, light therapy, all these things came together trying to address all the different sections of how the body can get stagnant, if that makes sense.
Yeah.
Yes.
Okay.
Makes perfect sense.
Okay.
So there's lots of questions brewing in my head now.
Oh, yeah. And I'm just scratching the surface.
Yeah.
Of the other things that are going on in the clinic, but yeah.
So you mentioned concussion.
Yes.
What other, I hate to say conditions because you're not treating a condition, right? But sure. What other symptoms and conditions are you seeing regularly in the patients that come to pursue your care? Oh my gosh.
So it's pretty broad.
Okay.
Right. So I'll get anything from autoimmune conditions and a range of them, tissue healing issues, right? So people that are slow healers, mm-hmm. right? Pre and post-op care, right? So I also get people that go out for cosmetic procedures and they want to reduce their risk for infections, and then post-operatively heal well with less scarring, right? Less fibrotic tissue because you're developing new vascular supply through the tissue that's been cut. Bones heal really quickly. So I do a lot of fracture care and bend, of course, because we're seeing a lot of broken things.
I'm sure.
Gosh, what else? I mean, sleep disorders tend to respond well, especially if a person has been hypoxic. Currently working with a couple of hypoxic injuries, one of which is a pharmaceutically induced hypoxia, and working to repair that, which is an interesting thing to get to with the person's health. Yeah, I don't know. I can keep going. And there's so many things it can do. I mean, if you just think about all the metabolic processes that the body requires oxygen for, and where it can stagnate or stop, and how you can get it to improve, oxygen's applicable. Mm-hmm. And it's fantastic because it really doesn't. You can't just do it off of breathing oxygen. You can't just do it off of pressure, increased pressure. It's the combination that's synergistic for a whole bunch of reasons, which you're going to ask me about. Yeah.
Well, it's funny because in my practice, you'll find me saying to people, are you familiar with the electron transport chain? Because I just want to, like, can we go to the nitty gritty of how your body actually makes energy within the cell with oxygen? It's so fascinating, right? But not everybody's going to understand it on that level, nor should they. But talk to us a little bit about.
Welcome to the Geek Squad.
Talk to us a little bit. Talk to the listener a little bit because we're getting granular in what you do. This is very granular, right?
Sure.
Cellular energy. What do you think? What do you tell your patients, or how do you educate people on cellular energy and the importance of oxygen?
So first off, you just have to meet people with where they're at, right? So not everybody even knows what a mitochondrion is, right? Or mitochondria.
Mm-hmm.
You say that, and they're like, I'm not familiar with that. So you have to tease out a little bit of like, what's the background, right? So how I generally explain these things is that oxygen is probably the most key nutrient for the body, right? And when you have accumulation of toxins, they can be mycotoxins, heavy metals, environmental toxins. It can be toxins from not flushing out inflammatory cells post-injury. How do you turn on the cells or push them into a healing state, right? How do you like flip the switch for them to upregulate their ATP production? Mm-hmm. And sometimes there are people that will catch that. And then there's sometimes I know that I'm talking to somebody who has a higher level of education than I do, and which is really fun because then it gets really nerdy in there. Yeah. So I think really to answer the question is explaining to people how vital oxygen is for every single cellular process within the body, period. And most people, when you lay it out like that and you say, how long can you live without oxygen? And then all of a sudden it clicks, right? And they go, oh, you're right. I have to have that. There's no way I can get around that conversation or disagree, right? So
that's beautiful.
Yep.
Yeah. Well, having had the benefit of being to your office and seeing the systems, like the actual hardware, so to speak, the systems you brought in, like hyperbaric oxygen chambers, yours are quite different from what I had previously experienced, which is like, you get into the sleeping bag type thing that they zip up and, pressurize it, and it's, 1.3 atmospheres or something like that.
Right.
But I'm assuming that yours are not only different, but I suspect you invested in them for a different reason. I'd love to hear more about just in that lane of oxygen, getting oxygen into the body. Why did you choose what you have, and what's unique about it, and what do you like about it, and all that good stuff?
That's a really good question. Thank you. So first off, every time I get a call about hyperbaric oxygen therapy at the office, it's at least a 20-minute education on the phone, period. And what you describe on the soft-sided chambers, the 1.3 atmospheres, that's considered mild hyperbarics, which is fine, right? It does some work for the body, but what really I think increases the efficacy of the treatment is to go up in pressure and up in oxygen concentration, because you're actually dissolving more oxygen deep into the tissues of the body via supersaturating the plasma of the blood, not just the hemoglobin molecule, but the plasma itself with oxygen. And then as the circulatory pathway makes its way through the body, just on natural gradient systems of oxygen having an affinity for our cells, it just disperses across the capillary beds, right? And then the oxygen gets picked up and utilized. So the reason why I moved over to hard shell chambers is because you have a higher oxygen concentration, higher pressure. So it means you can actually do more work per treatment on the body, so the patient gets more out of it. So there's that. The other thing is, when I looked at hyperbaric chambers, I wanted the most safe system I could find. And I wanted one that had controls on the inside of the chamber that mirror the ones on the outside, so that anybody who's inside the chamber, they have full operation if need be, as much as I do on the outside, which is allays a lot of stress for people that have a little bit of concern about being in there. The other thing that's really important in the choice of the chambers that I have is that they increase pressure on a linear scale instead of an exponential scale. So you've been in a soft-sided chamber, and when they go up in pressure, there's this buildup against the material, right? And the very tail end of pressurization, it just ramps up exponentially. So you'll see people in there trying to clear their ears out, feeling it's not a high pressure, but it happens quickly. And you can control it to some degree, but not like this, where you can, the chambers I have, you can set a pressure in kilopascals from 0.01 actually, all the way up to 100 kilopascals, which is 2 atmospheres. So, and then it progresses linearly, which is very, very gentle. And the sinuses, the ears, the lungs, that's super important to me. And you can choose the rate of which that progression happens. So those that are slow clearers, somebody has a slight cold, you can change the way that the chamber pressurizes to make it more comfortable and less likely for risk of tympanic membrane issues or eardrum ruptures. They will heal, but it's an inconvenience, and to date, I haven't had that happen. So, which is great. And then, I can just keep going. So,
Oh, no,
Just keep going.
I like
Okay.
it. This is
So
great.
interesting.
okay, so so that's important. And then in certain physiological laws of how you get oxygen to dissolve in a body of fluid, which is our bodies, you need to maintain a certain amount of pressure and temperature, right? So if you have the same temperature throughout the entire treatment, you can dissolve more oxygen throughout the treatment. It's kind of like carbonating a glass of water, right? If it's cold and you add pressure and CO2, and you can get it to dissolve faster if it's colder or at the same temperature. So holding and maintaining the same temperature throughout the entire treatment is really, really important, I think. I think you get more out of it. Even though maybe the temperature variations would be small, it's still important, because if you think about our body's physiology and the optimal temperature for enzymatic reactions, if you deviate from that a little bit, the body doesn't work so well. So you have to be able to maintain that, I think. So that, I think, is an important part of the decision-making process for those chambers. Plus, there's a huge window, and when you're laying in there, it doesn't make you feel like you're in a small confined space. You literally are laying in these chambers and you're looking out with nothing obstructing your view. And so it's peaceful. So it's fresh air constantly, temperature's cool, pressurization process is equal to how it goes down in pressure. You can pause the pressurization process from the inside. So if you do need a few extra minutes to clear your ears, you can do that by just the touch of a screen.
So I've read in certain conditions, maybe you need 30 sessions in hyperbaric or something like that. Is the number of sessions or the amount of time or the amount of exposure to the pressurized oxygen going to change for every person depending on what you're doing?
Yes.
Okay.
There's very few things that we do a one-off treatment for.
Okay.
That would be carbon monoxide poisoning.
Oh,
right. That's a very, very quick thing if it's an acute situation and they're not need to be in the hospital, right? So you can literally outcompete the hemoglobin molecule or the carbon monoxide with oxygen very, very quickly. When you're looking at long-term physiological changes, right, like you really want to push the neurological response, for example, you have to do it repetitively.
Okay.
It's a process, not an event, right? Because neurological tissue, even on its own, doesn't repair really quickly, right? And so what Hyperbarics does a really great job of is stimulating neurogenesis and remyelination of neurological tissue through a pathway of gene expressions.
Oh, yeah. Makes sense.
Yeah.
Okay.
This is fun.
But what about
I guess go on.
anemia? Okay. I think about this all the time.
Oh, yeah.
So what if you are anemic, as in you have low iron, that type of anemia, low iron, and so your red blood cells aren't going to carry as much oxygen? Can this help? How does this affect that?
So Hyperbarics does stimulate stem cell production. So that's important, right? So you get some increase of blood cells being produced. And when you supersede the oxygen carrying capacity of the body by saturating the plasma, you get a lot of other benefits, right? So even though a person may not have a ton of hemoglobin to carry the oxygen, you can get a lot of work done on the body in that short period of time with just having the plasma saturated.
Say more. What are the benefits? Tell us how that works. Yeah, give me. Yeah.
Yeah. So the benefits are just they're long. It's really like there's probably a couple hundred at least conditions that respond well to hyperbarics. There's only a very small list that's approved by insurance.
Right.
Those are usually people that they're at risk for losing a limb from out of control diabetes. They've got gangrenous wounds, osteomyelitis. Those types of life-threatening or limb-threatening conditions, those are the people that go to hyperbaric chambers that are way higher in pressure, way higher in oxygen concentration. They're being debrided. They're hanging on for their lives, right?
Yeah.
So probably about 9 conditions that are covered by insurance. But when you move insurance out of the picture, which happened quite a while ago for my clinic, it opens up a huge range of what you can do. You don't have that third person over here telling you what to do for the person in front of you, even though they have no relationship with them, right?
Right.
And, I'm speaking to the chorus here, right? Of course.
Yeah.
So, I mean, it's a really great tool for just anything inflammatory as well. You have folks that have high inflammatory responses. They're going through a healing process. They need a little boost. They're trying to detoxify from mycotoxins, heavy metals, and those things tend to clog up the electron transport chain, right? And so when you utilize that as a tool to help push and turn on those cells, even though they're being hindered and they're slowed down by the toxins, it helps push that thing through, because those things are constantly working against trying to kill you, right? That's what a toxin is, right? It's a slow poison. And so if you can get those toxins out by turning on the system that they're trying to turn off, that you can mobilize it out faster.
Yeah, and we talk a lot about microbes. So that made me then think, does it change the environment within the body and make it a more aerobic environment and affect the potential for infection?
It reduces the risk for infections.
Yeah.
Absolutely.
Okay.
We got to put one in at BDC.
Seriously, I know.
Since we're not close.
Really need one.
Well, okay, so we could go on and on about hyperbaric because I find it fascinating, but there's more. There's so much more.
You do more
that I want to get. Well, just what we experienced. Go ahead and finish your thought.
Well, I was just going to say, you have an operatory, correct? And you do this really extensive and beautiful work on people, and you want the tissues to heal really well. And the biggest concern from my perspective is that when you do a graft, right? When you do an extraction and you're doing a graft, the key is to get vascular supply, correct? You're doing red light therapy.
Right.
I've seen what your protocols that my patients bring over. Hyperbarics is an awesome tool to promote angiogenesis and revascularization of tissue that's been cut through, right? And I can tell you for sure that watching people heal post-operatively using hyperbarics versus the ones that do not, it's a remarkable difference. Swelling, edema, they literally bypass some of the bruising processes that you will normally see. The black and blue part, it goes to yellow, right? Instead of that. I mean, it's just really, really cool. I can talk about this I do this all day long.
Yeah.
And I think it fits right in with just about every sort of, chronic health pathway or for wellness. I know we're going to move on, but I mean, there's another group of people that use it like me. I use it for athletic recovery, right? So as a tool, when we have a wearable and you look at your heart rate variability and the way that your body bounces back after a hard day of skiing or mountain biking, whatever it is that you're into, you can take off at least a day of recovery time just by recovering with the chamber, right? And then and going back to your question about how many treatments and time are important, right? So you'll see a lot of clinics will operate in a 60-minute window for hyperbarics. You dig through the research, you find that 60 minutes at pressure is key, but if you're starting at, say 10 o'clock and the person's out at 11, you're not getting a full hour, right? So there's time and then there's a point at which 90 minutes that there's no really physiological benefit unless you're dealing with an infection, right? So life-threatening one. So I run my schedules on a 90-minute schedule so that people get a full hour plus at pressure. And so each person needs something else. Going back to the concussions and treatment protocols for that, generally it's about 40 treatments for a concussion repair, unless they have a lot of other healthcare conditions that could impede that process. And there's usually the metabolic processes that are already a problem, right? But it's really, really, really fun and consistently cool to watch people go from a concussed state where they're kind of glossy, they don't really remember much, they're irritable, their mood swings, they're angry, all the stuff that you can imagine. Concussion symptoms are broad. There's even a neuroendocrine impact too, where people have like thyroid disorder thereafter, or like their gut digestion. They become food sensitivity issues, right, post-concussion. But right around the 20th session, that's when the neurological response kicks on. And that's when people really start to shine. And they go, oh, I thought I was fine, but now I know. I feel better now. Like I'm more like myself.
Yeah, that's great.
It's really rewarding, and it's consistent.
Well.
Yeah.
So awesome.
Yeah.
So when we were there hanging out with you, one of the things, because you were so kind, you were asking like, well, anything you guys are dealing with? I'm like, well, geez, how many knee surgeries haven't I had? And so I want to touch base a little bit on the shockwave therapy, because I found that to be amazing. Both like the technology, what it does, and the experience. For me, that was pretty cool. And I also want to then get into what you were doing for Julie, where you were doing direct current assessment of health stuff, which I just was like, this is fascinating to watch. So is that okay if we start with
Absolutely.
Not electroshock, shockwave therapy? Is that what it's called? Yeah, not electroshock. I could use some of that.
Depends where you use it.
But the shockwave therapy, I had just like heard about it maybe once. I had no idea what it did.
Yeah.
But tell me about what's the technology, how does it provide benefit to tissue, and where you're finding it beneficial with patients?
Well, I think that's something you should incorporate into your practice.
Yeah, I got an email about it just this week, interestingly
Did
enough.
you really?
Yeah.
The benefits for reparative processes of the bone, that's significant.
Yeah.
And there has been, when we met, I read a little bit about it in regard to dentistry. And I think that there's technology advancements that are going to change the way that a person like you would practice, I would imagine, just for expediting the process and quality mineralization of the bone. Anyhow, so shockwave is a type of therapy that a sound wave is produced at 1,500 meters per second. And what it does is it stimulates, well, there's three benefits of it. Massive reduction in inflammation. It goes through a process of stimulating some cellular mediators that shut off some of the inflammatory pathways, not in a negative way because we still need some of them, but you literally can watch somebody's inflamed joint reduce in a treatment, like inches. Like it's remarkable. I've never seen anything like it. And then you have a deployment of stem cells, mesenchymal stem cells from the body to the area of treatment. So inflammation reduction, stem cell mitigation or migration, and then you have a process of angiogenesis or neovascularization, right? Same thing, right? What you do is, so you have tissue that's been damaged that gets stem cells and reduction in inflammation, and then it helps regenerate. So you can, what I've seen clinically with it, and what's really, really fun are my 70-plus-year-old skiers in Bend that have been told that they're on the path of joint replacement, right? They're getting their knees drained every quarter, or they're having the hydrocortisone flushed in, right? Then drained again in 4 months. So they get this high for about 2 months where it feels really, really good, and they're miserable for another 2 months, right? Yeah. And what's really cool about the shockwave or the stem wave treatment itself is that it does such a good job reducing pain and stimulating a healing process that a lot of these fellas and ladies are literally not in pain anymore. They are hiking Mount Bachelor, they're hiking Misery Ridge up at Smith Rock. They are doing things they haven't been able to do pain-free for a very long time. And that, if you can keep all of your original hardware, it's sometimes it is what it is. You have to have a joint replacement because it's just that far gone. It is the nature of using our bodies that way. But it's as a tool for ligament and tendon and articular cartilage. Works great on muscular injuries. What else do I use it for? There's benefits for going over fractures. Stimulates fracture repair, right?
So it's generally aimed at improving healing in areas that don't have a high level of vascularization on their own? Or are you also using it just to expedite healing? Sounds like it's generally expediting the healing process, what the body sort of wants to do, but much more effectively.
Yes. And the process, and I didn't really talk about the process, is an application of ultrasound gel, and then there's an applicator head that is pressed up against the body, and it's a sharp, crisp shockwave sound, right? So you can, when tissues are injured, let's say you get a bruise, for example, right? You get tearing of like little vascular structures, and it aches because there's metabolic byproducts that are building up. And pain in our bodies, as far as I'm concerned, is just a way of your body telling you that it needs a change. It's just what it's asking for. Yeah. Something hurts, you need to change it. Take your hand off the hot stove, fix my knee, right? And so, yeah, so that's kind of, I mean,
does it hurt?
Did I answer your question?
Does it hurt? Do you feel it?
I didn't think, well, you even told me, you're like, well, tell me if this gets like above a 2 or a 3 out of 10. And like the whole thing was a 1. I mean, you know.
Oh, you feel it.
It makes a heck of a noise.
You can feel it.
You feel it, yeah.
And if it's really acutely inflamed, you can really feel it.
Okay.
But it's not the goal to elicit a high pain response. Mm-hmm. You want it to be kind of lower in the pain response that the patient perceives. So in a way, you can actually use it as a diagnostic tool to identify the pain in the tissues that's been damaged by the pain response. Okay. But if you push too hard, you'll get what's called a shockwave hangover in the area of treatment. And you can be really quite miserable thereafter for, a couple days. And then it wears off and you're fine. But it doesn't cause any damage. Mm-hmm. It's just that you don't want to shy people away from treatment because they're, worse than they were the first time they came in. Right?
Yeah, that makes sense.
It's awesome. And I do agree with you that I think I haven't, taken a deep dive into it yet for the dental purposes. But I mean, for crying out loud, like I spend all my days helping people's jawbones get healthier. So I think there's, this will be cool to investigate, how can it be helpful? So for the sake of time, we're going to move on to the diagnostic stuff that you were utilizing, like direct current. I'd love for you to tell us about how you're using energy assessments to look at what's going on with people's bodies, how you're using energy to elevate health. I mean, I just found it fascinating.
So what you're speaking of is a process called, I would call it neuro-mapping. And I use a tool that is a direct current microcurrent tool in which there's it's a dual wave on the microcurrent, so they kind of overlap. So you can use a high amount of current without causing any cutaneous burns. Pretty nice. Yeah. But what's really, really special about that tool is that you can identify what I call freeze points or threats that the sensory motor cortex of the brain has deemed to protect a joint, for example. So that tool I use oftentimes on the more biomechanical side of the practice, where I have somebody who has a knee injury that we've been doing stem wave on, but we really want to get the biomechanics of it improved upon. So you have a knee injury, for example, on the right knee, and then left side sensory motor cortex has identified a threat because it's been hurting. So it shuts down certain muscles. It decides to inhibit the process a little bit for whatever reason. It just does that. And so using the tool by dragging a wet sponge along every single square inch of the limb and finding what's a really high pain point, period. So it's pain or a bruising feeling or a really stingy, prickly feel. Identifying those and then running current into those areas as the person's doing movements that are usually uncomfortable for them normally. And it helps tell the brain that it is okay, that this piece of hardware is now functional. And it's literally, I call it my software update for that particular part of the body. And it's really, really interesting because you'll find people that have had, let's say, a joint repair. They've had an ACL, a medial collateral ligament, some other surgical process, which the knee has been injured. And they can be a year post-op, and they still have sagging quads, or the VMO of the quad still isn't turned on, and they're still in pain, and they have perceived pain in the joint still. You map it, and you find these painful spots, either proximal or distal to where they're perceiving pain, even on bony structures like the tips of the toes, on the distal joints, the medial malleoli. I mean, all even on a lower extremity, I'll map all the way up to the lower part of the rib cage, front and back, and find hot spots which inhibit the body's biomechanics, and then run the current, have them do motions that typically are uncomfortable, and they're usually out of pain really, really quickly, and their muscles turn back on, and they're able to go back to competitions. People have had 10 years of chronic pain telling me they've had their best year of golfing even after a half dozen treatments. You know, when you're feeling searing hot pain in your legs and you're constantly guarded and you can't move, and you're like, oh, everything you want to do, I have to think about everything. Everything's a process. And then turning those switches on or off so that they can function biologically better or biomechanically. It's super fun.
So I'm making sure I'm understanding this, because I think I've had these experiences in my body. So I'm having a first person experience of what you're saying, but I want to make sure I'm right here, or I'm understanding. So when we have maybe an injury or damage to an area of the body, it sounds almost to me like there's a protective mechanism.
Yes.
That maybe a combination of the nerves and the muscles and everything else goes like, we're not going to engage that anymore. When we engage that hurts. And so then there's compensation from other tissues and other muscles.
Yes.
And then you get out of whack because you're not using all the right stuff together. And then what you're able to detect is where that has happened, and sort of retrain the neurons and just neurons? Is that what's happening?
I mean, yes.
Like a neuromuscular response, I suppose.
Totally. And it goes into, fascia, all the other connective tissues as well. I think there's a broad range of what it addresses. I have had the experience of finding a really, really, really hot, painful spot on a medial malleoli, the ankle bone on the medial part of the ankle, which was exquisitely tender for somebody who had a tendon that's tender on the 3 tendons of the pes anserine of the lower part of the knee, right? So the medial lower part of the knee. And finding the most significant pain spot on the malleoli. And the only thing I can think that would make sense is that there was distortion on the periosteum from the way that the tendon was pulling on that whole system of those 3 tendons. Yeah. And so resetting that, letting the body know that it was holding it for no real reason. Yeah. Right. So it's a diagnostic tool. It's a tool for resetting the software and the way that the body performs, and resetting the biomechanical capacities of it.
Yeah. Here's what I love about it is that it's non-invasive.
Oh,
and
right.
It's like, just having watched you, for Julie, she was having where she was feeling the greatest stimulus, prickling, was like the tips of her fingers. And you had, applied the things to her fingers and had her doing all these cool arm motions. And it was just fascinating to watch, and how she was dealing with, shoulder and neck tension. Yes. And how that was easing as she was. It's just amazing to watch that you can apply this and apply energy intentionally for improvements in, biomechanics and symptoms and such. Right.
And it doesn't follow any sort of known dermatological or neurological pathways that we see in all the classic textbooks. It's not like some myofascial trigger point referral system. It literally doesn't follow those paths, and it's never the same way twice. So every time a person comes in for the treatment, remap and you remap and you remap, because that's how complex the brain is and how it will constantly try to maneuver around this ingrained pattern that it's adapted, right? Rarely do I get acute injuries. It's usually people that come to me with really I don't know what to do. I've been dealing with this for months or years,
Because sometimes the area that somebody is experiencing the symptom has to do with an issue far, far away from that point in the body.
Absolutely.
And you have to figure out where that is. I remember being told I had a knee injury. Well, I thought I had a knee injury years ago. after I decided to build a pony paddock in one weekend, and I wore inappropriate shoes, as you might imagine. And I had a knee injury, and I finally, I was like, how did I do this? My knee is killing me. And finally, many, many months later, I find out, oh no, that's because your tailbone was damaged in your 56-hour labor with your 9.5-pound child. And over time, the movement caused later, you were compensating. For years, you were compensating. Your brain was trying to prevent you from feeling pain, which then deferred to a knee problem. And I think that was the first time I ever, the song, the knee bone's connected to the whatever. It was the first time I ever thought, holy cow, that is musculoskeletally, it is all connected, and it can be, trickery of the mind, that you're not actually ever feeling a symptom in the place that the damage was done.
Isn't that interesting?
Yeah, it's a fantastic tool.
I like it a lot.
Yeah.
It was so fun to watch because of my humanistic preferences, to watch you just listen to the body and be in observance as a true physician, paying attention. It was just so cool, and like it's not like, well, tell me here's your blood work. Let me give you your prescription pad and, crack your neck and you're out of here. Like it took time. To your point, like your experience, patient experiences in your practice requires time because you're really listening.
Absolutely. And I think quality of what you do is more important than volume.
Yeah.
I mean, it's just, you can build a practice out of volume and then eventually it's really dissatisfying, I think. And there are plenty of docs, just to give everybody credit for who they are.
Yeah.
There are plenty of people that do really, really well with bone out of place chiropractic models. And I have nothing negative to say about that. It was just, my path was different.
Yeah. Well, I love what you're doing. I believe in the future, we'd love to have you back and get into post-electromagnetic field therapy, biophotonics, things like that.
Neurofeedback. I mean, there's so many.
Because there's a lot of great stuff you're doing, but for the sake of time today, we're going to wrap this one up. We always like to end the Whole Health podcast by asking, what does whole health mean to you, and what would you like to share with our listeners?
As in your podcast and the work that you're doing?
Sure.
Oh, I think it's beautiful, to be honest with you. It means so much to align with you two. I've been listening to the podcast, your book, thank you. But it means that there's a shift in the way that we take care of people in the community, right? And when people are healthier and they are out of pain and they are feeling good, and we have a happier and more kind community throughout, right? And I think that's really important. That's one of the things that's always been a drive for me is the healthier people are, the less likely they are to be grumpy.
It's really true.
And it's nice to smile, and it's nice to be around people that are happy, right?
Yeah.
So true.
So that's what it means to me, right? It's a whole systematic look to improving the quality of the world.
Yeah. Well, I certainly hope to help more people, especially in the Bend area, come and find you because, one, I know a lot of people in Bend, but given the lifestyle people live there, like they're all on the move, having fun. They're out doing great things. But boy, when you're hurt, when you're suffering, that just shuts the whole fun time down. And I'm glad you bring up the point about when people feel well, they feel well.
Yeah.
And it's just, that's so beautifully and succinctly put. So thank you, Dr. Erich Lieberknecht, for coming and being a part of the Whole Health Podcast with us. This has been a ton of fun.
Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time.